Let's talk about a complication of diabetes that affects millions of people but often does it in complete silence. Seriously, it can cause damage for years without a single symptom showing up. We're talking about diabetic neuropathy, nerve damage, and today we're going to break down how you find it before it's too late. Okay, let's just jump right in with the single most important fact you need to know about this condition. 50%. So what on earth does this number represent? That's right. Up to half of all people with this type of nerve damage feel absolutely nothing. It is a completely silent problem. You could literally have it for years and not have a clue, which is exactly why we can't just wait around for symptoms to pop up. So that's the big question, isn't it? What exactly is this thing that can hide in plain sight? And more importantly, how do doctors actually uncover it before it causes any real, irreversible damage? All right, our investigation starts with the basics. We need a clear definition. What exactly is it that we're even looking for? So here's the deal. Diabetic neuropathy is, simply put, nerve damage that's caused by high blood sugar over a long period of time. Think of your nerves as your body's electrical wiring system. High glucose can, well, short-circuit that wiring, messing up the signals. It's also what's called a diagnosis of exclusion. All that means is your doctor will first make sure nothing else is causing the problem, like a vitamin deficiency or alcohol use, before they can say for sure it's related to diabetes. Now, neuropathy isn't just one single thing. It's really split into two main categories. First, you've got peripheral neuropathy. This is the one that affects the nerves way out in your extremities. We're talking your hands, your feet. Then there's autonomic neuropathy, and this one's different. It affects the nerves that control all your body's automatic functions. You know, the stuff you don't think about, like your heart rate, your digestion, and your blood pressure. So since half of the cases are totally silent, just waiting for symptoms to show up is not a great strategy. So how do we find the clues? This is where routine screening becomes absolutely critical. And the screening schedule is actually very specific. If you have type 2 diabetes, screening should start right away, at the moment of diagnosis, and that's because high blood sugar might have been around for years already. For type 1, it starts 5 years after diagnosis. And then, for everyone, it becomes an annual checkup from there. Now, you might hear screening tests and get a little worried. But honestly, this whole process is super simple and totally painless. It just starts with a conversation, your doctor asking about your history. Then they'll do a few quick tests on your feet, using stuff like a tiny pin to check sensation, a tuning fork to check for vibration, and this little soft plastic thread called a monofilament to test for protective sensation. That last one is so important for preventing foot ulcers. Okay, so detection is step 1. Taking action is step 2. Once you know what's going on, or what your risk is, the focus shifts to a clear strategy for preventing it or managing it. You know, the best way to prevent neuropathy, or at least slow it down, it really comes down to the fundamentals. This means getting tight control over your blood sugar, your blood pressure, and your cholesterol levels. And of course, managing your weight and getting regular physical activity are also total game changers for protecting your nerves. I want to be really upfront about this, because it's important. Right now, there isn't a treatment that can actually reverse the underlying nerve damage. So the goal of all the strategies we're about to talk about is to control the symptoms, especially the pain, prevent any more damage from happening, and just improve your overall quality of life. So for those who do experience those really tough symptoms, that burning, that tingling, or those shooting pains, the #1 goal is finding effective relief. And the good news here is that there are several classes of medication that are proven to be really effective. Doctors often start with drugs like pregabalin, duloxetine, or amitriptyline. Now, these aren't your typical painkillers. They work in a totally different way, by basically calming down the overactive nerve signals that are causing all that pain in the first place. Now, this is a huge deal, so listen up. While opioids can reduce pain in the short term, the American Academy of Neurology explicitly recommends against using them for diabetic nerve pain. And why is that? Well, because the long-term risks, we're talking addiction, overdose, even a higher risk of death, they just far, far outweigh any benefits, especially when there are so many other safer and effective options on the table. And what about that other type, autonomic neuropathy? Well, for that, management is all about tackling each specific symptom head-on. So for example, if you get dizzy when you stand up, that's called orthostatic hypotension. Treatment might involve things like compression garments or just adjusting your fluid and salt intake. For gastroparesis, which is just a fancy way of saying your stomach empties too slowly, a modified diet can make a world of difference. The goal is to manage the specific system that's been affected. All right, we have covered a lot of ground here, from the definition and detection to the strategies for managing it.
So what's the single most important thing to take away from all this?
It all boils down to this. Don't fear neuropathy, but absolutely respect it. It is a serious complication of diabetes, but, and this is the key part, it is also manageable. Your single most powerful tool is awareness and being proactive. That regular annual screening is what lets you and your doctor get ahead of it.
And that really just leaves us with one final question for you to think about. When you think about your last checkup, did it include a simple foot exam? If not, that's a conversation worth having with your doctor. Making sure that simple, painless screening happens every single year is the absolute key to protecting your nerve health for the long run.